Have you listened to your heart lately? Did you know that there's a heart rhythm disorder that is affecting over 33 million people worldwide? With that huge number, it is considered as the number one or the most common type of arrhythmia, that is irregular heartbeats. Specifically, the condition is called atrial fibrillation, commonly known as AFib. It is an irregular and often rapid heart rate that is causing poor blood flow. Now, there is good news. Medical breakthrough in 2024 are changing the game. From biodegradable sensor that monitor your heart in real time to AI-driven risk assessment and non-invasive focus procedure. The future of AFib management is here. Plus, we're seeing a new wave of anti-arrhythmic drug and improved NOACs that reduces the side effect while enhancing treatment outcome. These groundbreaking trends are giving patients the tool for better health and offering investors the opportunity to be a part of this life-changing process.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging Biotech hedge fund Evergrowth Biohealthcare Capital. We invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by utilizing that, we get able to position out properly and take advantage of those opportunities.
Within 6 months, we have over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Welcome to our Open Mic webinar. Today, I'm substituting for Dr. Van Nguyen, who is our chairman of the Medical and Scientific Advisory Committee. He's also a cardiologist and medical director of Biotech Medical Group, which is one of the largest hospital group in Florida. Today, I started out by discussing about topic for today is on atrial fibrillation or AFib in short. So today, I'm going to share with you an overview or summary of what I presented to our leadership team. First, I started out by defining atrial fibrillation or AFib, which is an irregular and often rapid heart condition with rapid heart rate that is causing poor blood flow. Here, as you can see from the ECG of a normal heartbeat, it's very regular, not too fast. And with atrial fibrillation, you see the irregular heartbeat right here, and also the rate of a heartbeat is also much faster. I then discussed about the etiology, that is the cause of AFib, and it is due to electrical abnormality that originate in the atria, that is the top chamber of the heart. I then discussed about the risk factor for this condition, which include high blood pressure, heart disease, and also excessive alcohol intake. Then presented the different type of AFib, and they include paroxysmal, persistent, and permanent. Paroxysmal, it just come and go, and then the more severe form is persistent, is long lasting, and also permanent is very consistent. For both persistent and permanent, treatment is required. With permanent is on the more severe scale of the spectrum, and with permanent, this condition is treatment resistant. Next, I discuss its effect on the body of how AFib due to the fact that it increases the risk of blood clot, and ultimately that will result in an increased risk of stroke. Also, other effect on the body is the increased risk of heart failure due to inefficiency of pumping blood throughout the body or circulation. I mentioned about the global prevalence for this condition that is affecting estimate of 33 million people worldwide, and is considered the most common form of arrhythmia. Then went over the symptom of this condition, which is characterized by palpitation or rapid heart rate, fatigue, shortness of breath, and dizziness. And all of the symptom is relating to the fact that the heart beat fast and is irregular, which make it unable to efficiently pump blood throughout the body. I then discuss about the signs of AFib, which include irregular heart rate, pulse deficit on examination. Next, I talk about the diagnosis. So on the ECG, as you saw earlier, look at the ECG, we can detect like the abnormal electrical activity or the abnormal pattern to help in the diagnosis, Holter monitoring, and also echocardiogram to assess the heart structure. I talk about treatment and outcome, which key is the medication, anticoagulant to prevent blood clot, which ultimately reduce the risk of stroke, and also medication to control the heart rate. And then for rhythm, to go to normal heart rhythm, we treat that with with cardioversion. Also, I talked about ablation to destroy the tissue with radio frequency. Also talked about surgical treatment like MACE procedure, and also lifestyle modification for better outcome like reducing alcohol intake, exercise, reducing blood pressure. We then discussed about new medical trend like biodegradable sensor for real-time monitoring of the condition, the use of AI in predictive modeling to assess the risks of AFib, also non-invasive treatment like the left atrial appendage removal. We discussed commonly prescribed medication like anticoagulant, which include the warfarin and the NOAC or novel oral anticoagulant. In short, I discussed about NOAC for the fact it does not require us to monitor the INR, and without having to monitor INR, the NOAC is more convenient for patient. It's also safer for patient as well. Other medication used to control the heart rate that I discussed include beta blocker, calcium channel blocker as well. Then we went into greater detail on newer medication like the NOAC, how it has fewer side effects, how it doesn't need to monitor INR. We then discussed the new anti-arrhythmic drug that is targeting specific pathway.
If you want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise, reach out to us, contact us. We'll schedule a call to see if we are the right fit for each other.